The vaccinations had been doled out on a stepwise basis, which in hindsight should have been a much wider vaccination campaign. We shouldn't have been dependent only on India-made vaccines.
You're watching Hindustan Times and I'm Aditi Prasad. I'm joined today by a special guest, Dr. Harman Boparai, an anesthesiology specialist and critical care doctor based in New York. Dr. Boparai traveled to his hometown Amritsar in India to help during the second surge of the COVID-19 pandemic. Interestingly, he was at the front lines of the fight against COVID in New York last year. Welcome to the show, Dr. Boparai. You've been here for a couple of weeks now. What is it that you feel that the healthcare system here is not doing, or it should have done, or it should have prepared for? And if you can, not just the larger healthcare system, but even the doctors that you're training, what are those little things that you feel that should have already been there and is not there that training should have been imparted already?
Whenever we think of an emergency or a pandemic, which is something like none of us in living history have seen, we have to look both from top down and bottom up. Now, from the bottom up, it is our role, the ones who have experience and the ones who are in the public health sphere or have had the trainings themselves, to train the doctors, nurses, ancillary staff in how they can best protect themselves, how they are to handle a surge in cases that overwhelms the capacity of that particular center, both in terms of logistics, supplies, in terms of how they handle the patients themselves, in terms of the protocols of care that need to be instituted. Whenever there's a time of crises, it is very hard for people to go back to the book and figure out what it is that needs to be done. Now, one of the trainings that I have is in trauma. And what you learn when you're in a trauma hospital is that you have to think in fractions of seconds. You almost have to have those trainings ingrained in you from the top down. Times like these, like we had over the last few months, which was tolerable in India, are times to institute policy or to look at our supply chains, our logistics infrastructure on what our preparedness is. This requires regular meetings of central as well as state bodies on COVID preparedness. And unfortunately, I think a lot of that has been lacking in India over the last few months, which is one of the reasons why our country is seeing such a difficult time.
All right. So what more could have been done by as you pointed out, have more meetings, get COVID prepared, but in terms of building capacity in our healthcare system, what more could have been done?
The very first step is data, the gathering of projections of what we expect in the coming weeks and months in terms of a surge in infections. Now, the vaccinations had been doled out on a stepwise basis, which in hindsight should have been a much wider vaccination campaign. We shouldn't have been dependent only on India-made vaccines. We should have made people eligible early on and made sure that we have orders placed and the capacity to vaccinate people when we have the time. Now, in addition to that, the projections that are made, the ICMR and institutes like that do predict the virulence, the transmissibility of the genomes that are coming in because the virus mutates. The natural course of a pandemic is that a virus usually goes from more virulent strains that harm patients more to more transmissible but less virulent strains, because that's how the virus reaches the widest population. Mm-hmm. We are not there yet. We are at a high transmissibility, but also at a high virulence, which is something that, given the time we had, I think that even now we can design policy in terms of how we can get the hospitals the oxygens they need, get the personnel trained and get them enough personnel, because that is another shortage we're facing. And, in emergency times, it needs to be all hands on deck.